cosmic abyss, my mind takes flight.
يلا
كسر.
هاي الفوكس.
بفضل من قدام تقشعه شوي بس خلينا ننطر دقيقة.
لأن أنا أعرف له هذا الجهاز.
ايش هو؟ خلاص.
لا هو هيدا تبعنا
من هنا.
لا هو خربان بنجرب نظبط وضعه ما بس
نقرا عليه ندوش هيك.
Update.
We'll wait a few more minutes just to make sure that everyone
نقرا عليه عشان يشتغل.
ما في يخرب زيادة.
group 3 yes it was good you had anything new you had new information the cases it's always interesting the cases because you can't really see all the cases all the time so sometimes it's really my name is Ghanwa. I'm the regional clinical specialist in Solventum. You did recognize the difference between 3M and Solventum, right? You understand what it is now? Okay, so we are Solventum now, the 3M previous healthcare. And you're going to have 3 workshop stations. So this is a workshop station for negative pressure wound therapy, open wounds only, and for the skin integrity, the Cavilon portfolio. Okay. We are going to focus a little bit about definitely not all the portfolio. We don't have the time for it all together, but we'll focus about few little things. So one major thing we are going to focus the big device of Vac Alta. Okay, the Vac Alta, and we are going to see very quickly the ActiVac, and we are going to talk about the 3 types of Cavilon, and we'll focus a little bit about Cavilon Advanced if you heard about it or not. Whom of you use the Vac Alta? Dressing or device? Okay, so you have. Do you use it with installation or without installation? With installation. Without installation. With. If you are using it with installation, are you using the Smart Install or the regular one?
One size.
The lazy one or the hard one?
The hard one.
The hard one,
Because
okay.
sometimes it's like when I use a smart one still, it will like if it's like excessive fluid, it will leak. So
Okay.
it's like calibrating شوية شوية.
I like the شوية شوية. Okay. Are you using the ActiVac?
Yes, me too.
First time. You are all from Saudi or all from Saudi? بدك احكي ActiVac or from Mashhad?
It's more for home health care.
Home healthcare. Okay, so we will skip it. No need to talk about it. We will move on.
Promoting all the
All right, perfect. And the Cavilon.
Yes, we have it.
Okay. So you do know that Cavilon, it's a trademark. It's not only one product. Not every time we say Cavilon, it means the same product. In the region, we have like 3 types of Cavilon, but in Europe and USA, we have like 7 types of Cavilon. It's a trademark used since 1999. The first Cavilon was the first time, 1999. Okay, so I believe we can turn it on without all the devils inside of it. Okay, until it's turned on. Yeah, bismillah. Do you have any difficulty applying the dressings?
Mushroom. Small, then big.
Then you put it
Then you put filling. That is the one you can do with your 7 centimeter dip.
Small ones. If not, it's okay. You can go ahead. So we can give it a try. If you hopefully it's going to work. Hopefully it's going to work.
Abu Dhabi.
Protecting the filling area when you are applying the bridging. And what are you protecting it with?
For DMG.
Sheikh Khalifa.
Okay. Do you ever try with Cavilon?
Cavilon.
Cavilon? Okay, bismillah.
Saudi.
any skin barrier.
So whom of you didn't try the Smart Install?
Because I didn't use this one with extra.
Perfect. So now I need all of you to look at the screen.
شوية كده.
You're all good? All right. So it's the VeraFlow Smart Install. Just to make it very clear, the same device has been upgraded. We have a new algorithm in the device. Medical engineer will pass to your units. They will upgrade it using USB and software and everything. But you still have the same device. What we are talking about is Smart Install because we are trying to make it more smart, the installation one, the VeraFlow one. You are used for fill assist. What you usually do, you go for fill assist. Yes, the fill assist is the tricky one. It's the hard one. So we put it in a way that's going to be more easy for you. It's just like 2 data that you need to put and that's it, well done. So what will happen, you are going to estimate the device. Instead of you estimating how much volume you are putting, the device will do the estimation. and it's going to put it, and it's going to lead you to the default setting of the device, which are based on the best evidence. You all worked with VeraFlow, the installation, right? So you know it's periodic. So we move for dwelling, soaking the wound, to negative pressure, then soaking, negative pressure. It's going to tell you how long you are going for the soaking, how long you are going for the negative pressure. The default are there. They are 10 minutes of soaking and 2 hours of negative pressure, continuous. If you need to change it, definitely you can go ahead and change it. You can change everything as you want. But those are the default settings, you can change it. So once you go, you are all familiar with the interface. What you are going to see different is the animation. We have more animation for you. So if there's any troubleshooting, you will have more designs, more animation of what to do, what's happening, and everything related to it. And you will also have extra messages sometimes. So I will press something and you will have one extra message. So we are taking VeraFlow. I already applied my dressing, protecting my wound, taking measurement. Also, never forget about undermining or tunneling. You need to fill it, white foam, right? So we go for VeraFlow. Now what's going to happen? The screen is going to change. So usually in your devices, you don't have this screen when you press the VeraFlow, right? So this is the new software. It's called here Smart Install. If for some reason you're not feeling comfortable with something new, you can go ahead and use the fill assist, the old one. But no, we made it much fun, much easy, much lazy for you also. So you go for Smart Install. And the moment you press Smart Install, you will start with the seal checking. So it already started. I didn't do anything. I just put that I want the seal check, the Smart Install. You only have 2 data to put. I told you, it's going to estimate everything. You don't have to put the size of the wound, the depth, or anything at all. It's going to estimate everything for you. The only 2 data that you need to insert is the size of the canister. So ours is 500. You go for 500. And if the canister is new or not. If it's a new wound, definitely it's going to be a new canister. So you go for, yes, it's a new canister. And like the French says, voila. That's it, literally. Now, what's going to happen during the next approximately 3 to 4 minutes? We are going to have the seal check, the regular seal checks that we are having, making sure that you don't have any leakage, whether it was from the dressing, from the connections, from the canister, the VeraLink, from the device itself. Everything is very good. It's going to do its own evaluation, the device. Do you have an appropriate negative pressure? Are we going well with the troubleshooting? Are all my senses going well? And so on.
Sorry to interrupt. Can I pass the questions for the new canister and?
No, you can't. Unless you know how much volume you are putting inside of it, so you can go for the advanced setting and you put manually everything.
Because sometimes some of people, they find it unnecessary steps. I want directly to go check my application, is it sealed, well sealed, and estimate installation and start therapy.
So without putting, you mean without putting the size of the canister?
Yeah.
Okay, the algorithm, this is the trick part of it. So there's a huge algorithm that's going to estimate the volume and the canister and everything around it. Because if, for any reason, the wound is too big, you are going to need more solution, you are going to need a bigger canister. So it will give you an alarm.
Definitely, I will estimate it.
Exactly.
As expert, I will estimate it.
Okay. What you used to use before, it was the fill assist, correct? So when you put the fill assist, what usually happens? It will take away the solution and put it inside the wound. And what we usually tell you, the recommendation is like to look at the wound, to press it, to check when it's a little bit puffy, and to assess how much volume it was in there, right? And then you put stop, and then you reduce 10 milliliter. Those are the old technique, correct? The tradition. Usually this is how we do it, correct? So then you remove the 10 milliliter, and then you put play. You remember the stop and the play? So we eliminated everything. We only put one step for you.
There is a special regime for the irrigation, the amount, the size of the wound. What the
Solution?
Advisable setting can use?
There's definitely no advisable setting for it because it always depends on the size of the wound and the condition of the patient. If you are asking about the solution, we have a compatible solution list that we can provide for you. You can check it. We can provide it for you, and you can pick whatever you want because it depends on the wound, whether it was infected and everything else.
Yeah.
For how long you are going to soak?
Yes,
yes, exactly. There's an international multidisciplinary consensus recommendation of different types of wound and what are the different even solution, what are the different settings that you want to put.
This is, I will enter all this information
No,
before I
you don't
start?
have to. So what we did in the device, we put like a default setting, which are like an average that will work for all the wounds.
Okay.
Yes, so we put the soaking time of 10 minutes and the negative pressure for 2 hours. So it's going to be a cycle of soaking 10 minutes, 2 hours, 10 and 2. If you need to change it, if you already know what type of settings you want to put in there, you want to increase the negative pressure, you want to increase the soaking time, even the volume or whatever, you can change it at any time.
Okay, what about the location of the wound? There is sitting, special sitting for the... there's something in the abdomen, is it the same in the leg or in
No,
the hands?
in this case, you are talking about different milliliter, or you need to change it, right? If you don't put OK, it will change it. After 10 minutes, it will move to negative pressure of 2 hours, and it will keep moving. But at any time, you can just put stop and put the settings that you need if you want to change anything at all. Okay. Any other questions?
Is the 16 milliliters the lowest?
It's an example. So, but it's a great question. So there are two extremities of the amount of solution that the device can estimate. Every wound that needs less than 6 milliliter or more than 500 milliliter, it will not estimate it. It will give you the wound is too big or it's too large, and it will jump to another screen where you are going to put the measures of the wound. But you can't get to the screen of measures of the wound. So you can start by putting the measures and estimating. No, if it's too small or too big, it will give you the screen of the measures of the wound. Okay, so this is what will happen. Other questions? Okay, so while it's
What about the sittings? There is...
it's still estimating. It's still
How much time?
No, it usually take 4 minutes, but because we stopped it and repeated again, so it's usually 3 to 4 minutes. It's okay, so it's still.
والله عند السيرجن 3 to 4 minutes كثيرة.
Do it yourself. And we don't have this application yet in our country.
Smartness, it's amazing. Just like 2 buttons and that's
اللي هو smart installation.
yes.
Okay.
We'll get it very easy later. So while we wait for it, if you want, when do you use these types of Cavilon? Do you use all 3 types of Cavilon?
Skin
Do you use this one?
That's for 70s, yeah? The effect is for 70s.
No, this
Yes.
is 7.
Yes, exactly.
How about the spray?
Okay. So we will position very fastly. So this one is purpose for prevention. You use it only for intact skin. After you reapply it after 3 to 4 washes, and you can use it as moisturizer because it contains dimethicone. So it already gave us that it's estimated 55 milliliter. Okay, can you see it's a 55 milliliter? So it's almost done the estimation, but until now it's 55 milliliter. All right. So it's very nice. Okay, give it 1 second. So this one you will use it for intact skin. So for intact skin, and then you will go for. Do you know the difference between this one and this one? Okay, so this is the 10 seconds window. It estimated 55. So either you go for play and it will give immediately, or you don't do anything. So we didn't do anything. It will give the 55 milliliter. Okay. And if you feel like 55 is too much, no, it doesn't need. You can post this pause button. All right. So if you feel. And after the 55 milliliter, definitely you have the countdown 16, 18, and for the full. And you can see the dressing being becoming puffy. And always make sure that all your connectors are open, right? The clamps are open. Always make sure. Yes, exactly. It has alarm troubleshooting for everything. For low battery, for canister is for blockage, for leak.
exactly when the block.
Yes.
هل هو في
the
one
new
side؟
update, the new update,
okay.
it will give you a blockage in the tube or canister
okay,
or dressing.
okay.
And give you solutions.
So now
Try to do
the
this,
soaking
try to do
time. This is your soaking time. 10 minutes of soaking time. This is the screen of the default settings. Okay, so it's 55 milliliter, 10 minutes soaking time, 125 millimercury, and 2 hours negative pressure. And we are in the installation volume. So you can change the dressing or you can just press OK.
Okay, if I want to play واحد من figures.
تبي تسوي مثلا مو 2 hours.
Yeah,
4 hours.
exactly.
Yes, you can just
press
put
on it.
change, change therapy settings, and you can
يزيد ونقص.
بتنقصه وبتزيد.
طيب هذا سؤالي في رجيم او شيء recommended مثلا اللون هذا اللي
Original recommend 2 hours negative pressure, negative pressure, negative pressure, and then it will put 55 milliliter again without measuring and estimating again, and then it will leave it for 10 minutes and then 2 hours negative until something beeps, you want to stop it, you want to change everything. Right? You will have alarms for the volume, the solution is empty, the canister is full, blockage, leakage, battery, low pressure, you will have alarm for everything in addition to the animation that you will get now.
We can set the frequency of installation.
Yes, you can at any moment change all the settings. If you don't like whatever you are seeing, you can change everything. We kept it the regular settings, the manual one. So if it's not your first time, for example, this is very good for the first time wound. You don't know how much it will need and so on. If it's your second, third dressing change, you don't need to go through everything. You go manual, you put everything and you move on.
الابديت في جي بي اس
GPS?
to know الجهاز
بعد ما وصلنا لهون المفروض بالمستشفى.
في شركات ثانيه عندها
في جي بي اس.
ما رجع بس هذا ما يطلع من المستشفى
بس هيدا usually for in
ما يطلع من
hospital.
المستشفى.
not for ambulatory patient يعني outside أو شيء. هيدا كيف for ambulatory patient يعني if you wanna leave yes take it. But this one is لا هيدا يعني أصلاً he will not know how to manipulate unless he has like 24-hour nurse with all the material and it's going to be more costly at home.
so if you want to upgrade it you can call
You are in Saudi or Abu Dhabi? Abu Dhabi. Which hospital? Oh, Zayed military. I will tell the guys. Zayed military. How many devices do you have? Wow.
احنا عندنا 8 طالبين نظر
So, what do you think about it compared to the
خمينا
FSS?
بوس عادي
No, it's like lazy, not even easy. Yeah, it's like 500 milliliter, yes, in your canister, and move on. Do you have any questions? Yes, it needs upgraded, definitely. It needs upgraded.
So as you know, the Pivina is closed incision, negative pressure, won't generate. So it's we applied negative pressure over the closed incision after suture or staples. It's post-op dressing, right? So it should be done in sterile environment, and it will prevent from any external contamination. It's viral-proof, bacterial-proof, and water-proof. So it will deliver pressure of minus 125 millimercury on the incision and surrounding tissue, and all the exudate will be extracted from the canister away from the incision. So this will help to prevent maceration. If we have a look on the dressing itself, we found that it is like silver, 0.019% silver. So even if there is silver, it's not considered as antimicrobial dressing, but this silver it will help to reduce the bacterial decolonization inside the dressing itself. So if I'm talking about the dressing of the Pivina, so the Pivina has multiple size of dressing. So as you see here, so we have the peel and place 13 centimeter dressing. We have the peel and place 20 centimeter dressing. We have the 35 and we have the 90 centimeter, which is the customizable one. What is the difference? For the 13 centimeter and 20 centimeter, they should be connected with Pivina 125 therapy, what you have here, you see it later. Okay, this one. And here the canister is 45 ml. However, if you are expecting to have more exudate, so we have the 35 centimeter and the customizable one, which should be connected to the Pivina Plus with a canister of 150 ml. So we have bigger canister. However, all the dressing can be connected to the vac therapy with, the big canister up to 500 ml. When I'm talking with the customizable one, so it depends on your incision and your need. So it's looking like this. We can customize it up to your need, and also you can connect it to the vac because it's expected to have more exudate. Is it clear until here? Okay. So as you know, the Plevina, it's FDA medical device approved to reduce the surgical site infection and seroma for high-risk patients. So it's not for all type of patients. And the question here, how can we identify those patients, who are a high-risk patient? And that's why what you are seeing in front of you, which is the International Multidisciplinary Consensus Recommendation. This is actually a group of surgeons and infection specialists. They agreed and come up with the algorithm to identify which kind of this high-risk patient can have the benefit of the Plevina. And then they come up with 3 risk factors. The first one, which is the patient-related risk factor. Does it mean if the comorbidity, the BMI of the patient, for example? We have the second one, which is the incision-related risk factor. It can be, for example, contaminated incision. It can be as well repeated incision. Now this is considered as incision risk factor. And the third part, which is related to the surgery itself, the type of the surgery, which can be, for example, sterotomy or abdominoplasty or open surgery. So this is my different, and this is how we can see those high-risk patients. Before to move here, let's go to the station. If you don't mind, you can just be in the station and see how it's working.
Let's go.
Okay, so what we are having in the box of the Plevina, so we'll be having the device. We have this box, this bag, let's say. So this is for the patient. It can be easy, yes, to hold it and move with it. We have the canister one. This is the device, and we have the dressing. Okay.
With the battery.
With battery?
With battery.
Battery, yes. And this is the dressing.
Double A.
Yes. Just will open. Yeah. So here one of the dressing that we put it already in the other group. So this is look like the incision, and then here we put the dressing over here. Here I will show you how to just to press here to see the canister. So this is the small canister. Right? This is the 45 centimeter small one, and here the device. Just wait. Okay. Here the battery. Okay.
Rechargeable?
No.
Double
Single
A. Included in the
Single
package,
use.
together with the box.
14 days?
7 days.
7 days.
The other one. Yeah,
Okay, so to put it on, all we need is to press this turn on button, press 3 to 5 seconds, and keep pressing. We'll have this sound. Start. And start the suction. The suction, it will have the, what is the pressure? 125, yes. Okay, the time that it is sucked, just I will explain to you the way it happens. So we find you will get using like this. How to apply this feel and place is very easy. Just to click and press it over here. The thing that we need to highlight is it's not recommended or no stretch on the patient's skin. Please for the skin stripping or having marcy. So to avoid, so just place it over the incision part. Okay, and then you remove it. This is not extra here to fix it. If you want to fix, so you have this extra thing in the box. Sorry, and then you need to plate the surrounding to know any leakage. Because if there is any leakage, anyway, you will have it as troubleshooted on the device. Yeah. Okay. Okay.
Sorry, this is
So it should be actually the sound it will stop once it reaches the 25 pressure. Now because we get some leakage, to be honest, you can see that we have using this dressing for many times, so that's why it's expected. What you want to show you here, what you can see the difference between both.
this one and this one. You see, it's reduced the lateral tension
Like
for the
exactly.
suture,
And the
for the
edges
staples, for
together.
the glue. That's why it will give you a less
better,
scar
yeah.
formation and a better taking.
So here, yeah, the close of the edges, and It will reduce also, you'll have reduce the edema, the seroma. It will increase the skin perfusion as well, and for sure at the long term, you'll have better healing of the wound. So how to fix it? As I show here, you need to twist it. Please make sure that you twist it well, because sometimes they don't twist it well, so you will have leakage, so that's why you will have the sound.
The click sound.
Yeah, the click, yeah, exactly. And the sound of the device, this one, it will stop once it will reach 125, so you will not hear
It will
this.
be silent. If
It
you
will be
hear
silent
this
after
voice,
this.
it means there is a leakage.
A leakage, yeah.
So you have to take care of this.
So also to stop it, just
Press
keep
and hold.
pressing. And you'll have.
This type of foam, it's safe to apply on direct skin, right?
Yes.
Yes.
We can discharge patient with this.
Exactly.
In case patient develop any.
Exactly. So I will show you here even how to. It's waterproof. Even the patient can have
Take a shower.
shower with the can, and even see he can put it on the hip just crossbody as a like small bag like this. In case the battery will finish, it will have a sound so that there is troubleshooting and you can
We
change
give
the
you
battery.
alarm also here.
Alarming there.
That the battery is low, so you have to change the battery.
Change
Because-
the battery.
Yeah.
The battery life is 7 days also.
Yeah, normally it's okay for 7 days, but if there is a leakage, continuous leakage, it will end.
As I
So
mentioned,
if
yeah.
in any case patient, any complication means accidental removal or peel out or anything, patient has
To go back to the healthcare provider and they will take a look and diagnose what is the problem, if there is a leakage, if there is
how long he can wait, like till he reach the hospital. Like before, we know that other active pressure within 2 hours we have to change it.
Same thing you can
Same.
do for
Same thing. More than this, you have to change the kit.
Usually with the vac, you are afraid because the wound is exuding.
Yeah.
So if you kept it for more than 2 hours, maybe it will cause maceration damage. This one, there's not expected much
we don't
oozing,
have
but
that
it's better
risk,
to be within the 2 hours.
Because I didn't show you just here because this one already used it on this one. I just want to show you yeah, how to peel it. Sorry. The laptop.
And this will work for لا هذا انسجين مانجمنت سيستم فقط بس للانسجين هذا بس عشان الكانستر اصلا small canister 45 ml only for to deal with if there is a little oozing from the incision. That's it. And this is only approved to use over a closed incision.
So just here how to peel it, just in front of you, because, and then just you will place it on the incision itself. And you will place this around it for any leakage. Yeah, it should be in the sterile environment. And then it will remove and press. It will be very easy to remove. See, the hand on the top and just use it. Yeah. And then you will connect this one. This one. So this is the thick one that she talked about it.
In case we are troubleshooting, we can remove and reapply the same system.
Yeah.
We can use the same system.
There is troubleshooting. You need to know what maybe there is a leakage over here or leakage about.
Reapply, yeah.
No, maybe you need just to press more here so there is no leakage anymore.
Accidental.
No,
Exactly.
no need to have another. So any questions? So
How long will you need to keep the
7 days, up to 7 days. Yeah.
Usually doctors, after day 5, they maybe take a look and maybe they will complete for the 7 days or they will remove it at day 5. But our recommendation from 5 to 7.
And it's
You know, because يعني it's close incision.
I step up to the mic, gonna make it swing. Feel the rhythm in your bones, let the music sing. Got that poppin' beat, gonna make you move. Dancing on the floor in the swinging groove. Clap your hands hands now, let the trumpets sound. Swinging to the left and swing.